Okay, good day. So, continuation natin sa sa IMCI. Okay, number 21. The treatment for some dehydration is. So, keyword natin is some dehydration. So, some dehydration is okay, plan B. Plan B. Yan. Okay, so plan B tayo dyan. Yung plan A, home treatment yan. Plan B, RHU. Plan C, sa hospital usually. Okay? Next is treatment of no dehydration. So, keyword natin is no dehydration. So, pag sinabing no dehydration, sa bahay lang yung ginagawa. Pag sa bahay, okay, ang tawag dyan is plan A. So, plan A, meron tayong mnemonics na ECCW. So, ano yung ECCW? Okay, so, ito yung mga binibigay natin na extra fluid, zinc supplement, continue feeding, and when to return. Okay, so usually yan yung sinasabi natin. Next, number 23. Okay, the treatment for some dehydration with other severe classification. Okay, keyword natin some and severe. So, ang ginagawa natin dyan sa RHU is refer urgently. So, ang tamang sagot, letter D, refer urgently. Okay, so halimbawa kung may severe classification siya, usually yung mga Cuba, nandyan mo na yung Cuba. So, ano yung C? Convulsion, unable to drink, vomits everything, abnormally sleepy. Okay, so number 24, you will classify a child as severe dehydration. Pag sinabing severe dehydration, meron siyang very slowly. Okay, doon tayo sa number 1, abnormally sleepy. Okay, sunken eyes, not able to drink, restless, irritable. Okay, meron ata lahat yan ba? Okay, so skin pains goes back slowly. Okay, yung number 6, hindi pwede. So, ang ano lang dyan is abnormally sleepy, sunken eyes, and not able to drink. Yun yung Cuba. Okay, so, ang keyword natin kasi doon is lens. Okay, number 25. Ang sagot po sa number 24 is B. Okay, 25. Ang sagot natin dyan is letter A, severe persistent diarrhea. Severe persistent. Kasi ang keyword natin is 14 days or more. Okay? Pag less than 14 days, yun yung persistent diarrhea. Okay? So, ang sagot dyan is A. Next, number 20. Okay, 26. Sa 26 tayo, blood in the stool is classified as. Okay, classified as dysentery. Tandaan, classification ang tinatanong. Hindi yung tawag. Okay? Kasi pag ano yan, medical term is melena. Okay? So, ang tinatanong kasi is blood in the stool classification. So, dysentery ang tawag dyan. Okay, pag sinabing dysentery, so usually ang best treatment natin is Cipro. Okay? Next, number 27, treatment of very severe febrile malaria. Okay, malaria include the following. Okay, keyword natin, except. So, ang keyword natin dyan, except is, okay, tandaan. Sa IMCI, pwedeng bigyan natin ng vitamin A except po ang malaria. Okay, so ang sagot dyan is letter D, give vitamin A. Okay, tandaan, pag hindi pala nasagutan to, pwedeng yung i-pause and then pakinggan yung rationale niya. Okay, yung sagot niya. Okay, next, number 28, if the blood smear of the child is positive. Okay, keyword, positive. So, pag sinabing positive, you will classify it as okay, Mle Review. Okay, ano yan, tayo wrong typographical error. So, the answer is letter B. Pag negative stiff neck naman, dun sa A yun. Tapos, pag negative blood smear, dun sa letter C. Okay? Ayan. So, please like, subscribe, okay? And share na rin. Next, number 29. Okay, if the child has stiff neck, sabi natin kanina, you will classify as with stiff neck daw. Stiff neck, the answer is very febrile disease and malaria. So, letter A. Okay, letter A ang sagot dyan. Next tayo, anong next number yan? Number 30. 30. So, ang topic natin sa 30 is about measles. So, ang keyword natin dyan is cornea or deep extensive mouth ulcer. Okay, keyword extensive. So, you will classify as severe complicated measles. Okay? It should be letter A. Okay? Meron siyang deep extensive, okay, mouth ulcers. Ito yung mga lumalabas sa IMCI. So, PHC yan. Ito yung mga common board. So, tinanong yung mga keyword yung mga sinasabi kong keyword niya. Okay, next, number 31. The child has past training from the eye. Okay, tandaan, may eye problem siya. So, with eye or mouth complication ang sagot. Letter B. Measles with eye or mouth complications. So, ang sagot dyan, letter B. Keyword natin, past training from the eye. Okay? So, next, number 32. Keyword natin is persistent vomiting. So, pag sinabing persistent vomiting with abdominal pain or skin fatigue, you will treat as... Okay, the answer is... Okay, DHF tayo, dengue fever tayo. So, wala naman nakalagay dyan na sign and symptoms of bleeding. Kung may bleeding sana, plan C. Pero kung walang bleeding is plan B. So, plan B tayo. Ang sagot. Letter boy. Next, dito tayo sa number 33. Meron bang signs of bleeding? Tandaan, may keyword ay signs of bleeding. So, pag sinabing signs of bleeding, so plan C ang sagot dyan. Plan C. Okay, sabi natin, plan A, home treatment. Pag sinabing plan B, ORS, okay, reformulated. Then, pag sinabing plan C, IBF, or pwede rin yung NGT. Tama ba? Okay. Next number is number 34. Okay. So, keyword natin dyan, except. Tandaan, sa dengue hemorrhagic fever, ang except dyan is give aspirin. Tandaan, pag may bleeding, ang anong plan? Plan C. Pag walang bleeding, plan B. Okay? So, pwede yan. Child prevent low blood sugar. Pwede yan. Follow up in 2 days. And, okay. So, bawal yung aspirin. Ano ba yung aspirin kasi? Okay. Pinapalabnaw yung dugo. Kaya nagkukos ng bleeding din minsan. Okay? Next, number 35, if the child has tender swelling behind the ear, okay, ito yung definition ng mastoiditis. Tandaan. Okay, pag may fever, may lagnat, okay, or masakit, binibigyan natin ng paracetamol. Okay? So, yung acute ear infection at saka chronic ear infection, ng pinagkaiba is yung less than 14 days saka greater than 14 days. Okay? Next, number 36. So, ang keyword natin dyan is 114 mm circumference, mid-upper, yung muwak. So, 114 is less than the normal. So, ang sagot dyan sa malnutrition tayo, A, severe malnutrition. Ang normal is 115, okay, mm. So, we'll classify as severe malnutrition yan. Next, number 30. Okay, 37. The child is having a very low weight for age. Okay, tandaan, very low weight for age. So, ang follow-up natin dyan, tandaan, is 30 days. Okay, very low weight for age. Ang haba, di ba? So, ang ano na yan is 30 days. Letter D. 30 days. Okay. Next, natin is number 38. Okay, wait lang. Number 38, severe palmar pallor. Okay, keyword natin is severe. Pag sinabing severe, nandun yun, no? Severe palmar pallor. So, ang sagot dyan is severe anemia. Pag yung letter anemia lang, okay, some palmar pallor yan. Okay, yung jaundice, saka severe jaundice, ayan, yellowish ang dyan, bata, minsan, di ba? Okay, so may tayo sa jaundice. Yun, yung pathologic at saka physiologic. Okay. Next, number 39. Which of the following contraindication in giving albendazole in a child of having anemia? Tandaan, nakalagay doon 11 months old. Okay? So, hindi pwede yung magbigay ng albendazole sa less than 1 year old. Okay? Doon sa letter C, hindi na nakalagay yung yung age. Kaya, ang tamang sagot dyan is letter A. Okay? Next, number 40. Number 40, ang keyword natin is young infant. Pag sinabing young infant is 0 to 2 months. Okay? Sa IMCI kasi may dalawa tayong client. yung young infant at saka yung sick child. Okay? So 0 to 2 months yung young infant, 2 months to 5 years naman yung sick child. Okay? So ang tamang sagot dyan is letter C, 14 days. 14 days. Okay? Next, number 41 tayo. The best way to evaluate the mother after giving health teaching. Okay, tandaan. Return demonstration ang tamang sagot. Okay? Lahat naman, di ba? Lahat ng mga procedures para malaman natin na natutunan ng pasyente or yung mother is return demonstration. Okay? Usually, yan ang tamang sagot. Okay? 100% kung nakita yan. Yan na yan. Okay? Next question is number 42. Okay, the first line antibiotic. Okay, keyword natin is first line antibiotic for a child having pneumonia. Tandaan, ang sagot is amoxicillin. Amoxicillin. Second is Cotri. Okay, second line is Cotri. So, ang sagot dyan, 42, first line is amoxicillin. Okay, tandaan, first line antibiotic nung pneumonia is amox, second line is Cotri. Next question is number 43. Number 43, keyword natin, blood in the stool. Okay, sinabi ko na yung sagot kanina, blood in the stool, dysentery. Ito yung classification niya, dysentery, ciprofloxacin. Tandaan, ciprofloxacin. Yung tetra is, cholera. Tapos, yung amoxicillin, first line ng pneumonia. Okay, Cotri, second line ng pneumonia. Okay? So, next tayo is number 44. So, if there would be an outbreak, okay, so yung cholera daw, okay, cholera, sagot dyan is tetracycline. Okay, so tetracycline, letter D. So, tandaan, sabi natin kanina, amoxicillin is first line of, okay, pneumonia, second line is Cotri, then ciprofloxacin is, ciprofloxacin is doon sa, nakalimutan ko na, blood in the stool or yung dysentery. Okay, dysentery. Next, number 45. Number 45 is the classification of the child is having dysentery with pneumonia. Okay, tandaan. Dysentery, tapos may pneumonia. Okay, ang samang sagot dyan is, okay, ciprofloxacin. Ciprofloxacin po. Okay, so sabi natin kanina, tetracycline is sa cholera. Second line ng pneumonia is Cotri. First line ng pneumonia is amoxicillin. Okay, next, number 46. Number 46 is, okay, a child is classified as having malaria. Okay, malaria daw. You know that the first line of anti-malaria is, okay, samang sagot dyan, artemether, lumefantrine. Okay, yung safest na binibigay natin sa yung chloroquine, safest for pregnant mother. Tapos yung antidote niya is, antifolate daw. Antifolate is pyrimethamine. Letter D po yun. Okay? Pyrimethamine. So, ang tamang sagot dyan is artemether, lumefantrine. Letter C. Next, number 47. So, after giving chloroquine daw in a child, you must instruct the mother to what? Okay? So, sabi natin kanina, ang chloroquine is yung safest, pero ang most common dyan na is vomiting and itchiness. So, ang sagot dyan, watch out for 30 minutes. Okay? O baka isuka niya lang. Okay. Next, number 48. Number 48, if the child vomits after giving chloroquine, okay, what would be the next action? Okay? So, repeat the dose. Pero tandaan, kung ilang minutes yung pag-vomit niya, within 30 minutes, wag na. Okay? Wag mo nang i-repeat yung dose kung within 30 minutes yung pag-vomit niya, or immediately, pag immediately lang, i-repeat natin yung dose. Okay? Tama ba? Gets? Okay, so answer 48 is letter A. Next, number 49, you must educate the mother that the common side effect of chloroquine. Okay, common side effect, tandaan. Okay, dalawa yung kasi yung lumalabas, itchiness and vomiting. Or pwede rin yung nausea. Okay, so ang pipiliin natin yan is letter C, itchiness. So, the common side effect. Okay, napangangati. Next, number 50. Wait lang. Ano ba? So, number 50 is, Young, okay, you must educate the mother that in taking artemether-lumefantrine, you must increase her diet. It what? So, diet daw. So, anong diet? Is letter B, fat. Okay, so, faster na absorption or pwedeng gastric irritation, pwede rin yun. Yung rationale niya. Okay? So, the answer, number 50, letter B. Okay? So, for part 3, please like, share, and subscribe. Thank you. Okay, good day. So, ang topic natin ngayon is about child immunization record. So, ito yan. Child immunization record. Tapos, ito yung content niya. So, child's name, date of birth, place of birth, address, mother's name, father's name, birth weight, birth height, and yung sex niya. Okay, so ngayon dito tayo sa table na to. So, makikita natin dito yung bakuna, sakit na iwasan, mga narekomendang edad ng bata. Okay? Tapos dito may mga paala-ala, sabi niya. So, nagsisimula ang pagbabakuna ng bata sa kapanganakan. Sundin ang schedule ng bakuna at siguruhing makumpleto ang mga ito hanggang sumapit ang kanyang unang kaarawan. Okay? Ang mga bakunang hindi nakalista ay maaring makuha sa mga pribadong ospital o doktor. Tapos itago ang card bilang patunay sa mga bakunang natanggap ng iyong anak. Kailangan kasi ito sa school entrance, usually sa grade 1. Okay? So ngayon, ito yung table na papakompleto ko sa inyo. Ito yung table. Okay? So, babasahin natin. Vaccine. Tapos, disease to be prevented. Yung months to be given. Yung 0, 6, 10, 14, 9, 12. Tapos yung dosage niya. And then yung route at saka yung site. So, ano yung pinagkaiba ng route at saka site? So, yung route, yun yung path by which vaccine brought into the body. So, usually, ito yung mga ano yun? IM, SC, oral, at saka ID. Okay? So, may mga ano yan, iba-ibang description nun or definition. Okay? So, ngayon, dito tayo sa dito sa ano yan? Table. Pakumpleto muna yung table tapos i-discuss natin kung ano yung mga pinaka common board question dito sa vaccines. Okay? So, number 1, yung BCG natin. Okay? So, ano yung pre-prevent na gamot? Ay, na pre-prevent na diseases. Okay? Ito yung tuberculosis. Tapos, binibigay saan? O, kailan pala binibigay? Okay? Kailan? So, at birth siya binibigay kasama ng hepatitis B. Okay? Yung monovalent na hepatitis B natin. So, yung BCG, anong route? Usually, anong route niya is ID. Intradermal. Okay? So, intradermal siya sa right upper arm. Okay? Near deltoid. Okay? Tapos, next, yung ang dosage niya is 0.05 ml. Next, yung hepatitis B natin. So, hepatitis B, sakit na maiwasan, hepatitis. Then, binibigay kay 0 or at birth. Tapos, dosage niya is 0.05 ml. Tapos, anong route? Okay, IM siya. Tapos, doon sa vastus lateralis. Okay, next, pentavalent. So, ano yung pentavalent natin? So, ang pentavalent natin is yung DPT, Hep B, at saka yung HIV. So, ang mga diseases na na-prevent niya, diphtheria, tetanus, Hepa B, pertussis, pneumonia, and meningitis. 1, 2, 3, 4, 5, 6. So, 6 yan. Okay, kailan binibigay? Okay, 6 weeks, 10 weeks, and 14 weeks. So, 1 and 1/2 1. Okay, 2 and 1/2 months, 3 and 1/2. So, yan, binibigay. Kasama ni oral polio. So, anong dosages or dosage ni pentavalent? 0.5 ml. Okay? Saan binibigay? Sa anong route niya is IM. Site is vastus lateralis. Or usually right yan. Right. Okay? Next, oral polio. Oral yan. Ilang dosage? Dosage is 2 drops. Okay, route natin. Oral and then mouth. Mouth yung site. Next, IPV or yung inactivated polio vaccine or sakit na maiwasan or disease prevented is polio. Kailan binibigay? Okay, 3 and a half. Okay, 3 and a half yan binibigyan. So, route natin, IM sa may left vastus lateralis. Okay? Kasama doon ni PCB. Okay, so ang pagitan nun is 2.5 cm or 2 finger breadth. O kung wala, pwedeng 1 inch. Okay? Next, si PCB, pneumococcal conjugate vaccine. Ang piniprevent niya is pneumonia at meningitis. Binibigay din siya ng 1 and 1/2, 2 and 1/2, and 3 and 1/2. Okay, sabi na natin, ibibigay sa left vastus lateralis. Okay? Saan? Mas mataas kay IPB. So, si PCB muna, and then si IPB. Okay? So, doon. Tandaan, yan yung 3 and a half months natin ha. Okay? Kasi 4 yung ibibigay sa 3 and a half months. Si Penta, si oral polio, si inactivated polio, at saka si PCB. Okay? 0.5 ml din yan. Okay? Sa vastus lateralis tayo dyan. Okay? Next is yung MMR or measles, mumps, rubella. Okay? Tandaan, 9 months yan binibigay at saka 12 months. Okay? Okay, wait lang. So, ang route natin is sub-Q. Okay, sub-Q siya. 0.5 ml. Tandaan, sub-Q saan? Sa right upper arm. Tandaan, right upper arm. Okay, sub-Q. Okay, so pag may outbreak tayo, outbreak, kailan binibigay ang MMR? At 6 months. Early as 6 months. Pag may outbreak. Okay, so please, okay, subscribe, like, and share for more videos and review. Okay, thank you. Okay, nandito ka pa? Sige, tips. Para mag-top sa board exam, kailangan mong isulat yung tables natin. I-memorize mo. Okay, memorize. Okay, mga 5 to 10 times memorize mo yun. Okay, top sa board. Okay guys, topic natin ngayon is about Jama'a. So what is Jama'a? Ito yung circumstances affecting criminal liability. Okay, letter J. So justifying. So ito yung components or elements ng justifying. So self-defense, fulfillment of duty, obedience to an order from superior. Okay, so self-defense tayo. So self-defense, may element siya. So reasonable necessity, unlawful aggression, or lack of sufficient provocation. So pag sinabing self-defense, pinagtanggol mo na yung sarili mo, tama ba? Okay? So limbawa, nire-rape ka, tapos yun, yung reason mo na patay mo siya. Pwede self-defense yan. Okay? Next, fulfillment of duty. Okay? So habang ginagawa mo yung duty mo, tapos aksidente, parang ganun. So there's something wrong na nagawa or saan aksidente siya. Okay, so obedience to an order from superior. Okay, so it must be lawful, then superior acting within the scope of practice. Pag sinabi yung scope of practice, ito yung sa midwifery. Okay, midwifery practice natin, di ba? So halimbawa, nagtatahe or yung sa suturing, tapos paano siya? Inamatay siya sa sa bleeding, hypovolemic, di ba? Parang gano'n. Okay, so ayun, ay superior ka doon. Okay, so justifying. Next is exempting. So exempting naman is ito yung insane performance of a lawful act causes injury by mere accident. So accidentally, parang gano'n. And then under 9-year-old, then under compulsion of uncontrollable force. O, ito, parang pinipilit ka, di ba? Tapos, next, under impulse of uncontrollable fear. O, yun, same lang. Magkaparehas lang din. Failure to perform an act required by law when prevented by some lawful cause. Okay, mahirap yan, So, failure to perform an act, o hindi mo daw nagawa, required by law when prevented by some lawful causes. Okay. So, doon tayo sa insane. Example niyan, halimbawa, yung baliw daw, ni-rape nung, na-rape ng, rape ng midwife. So, exempted yun. Okay? Yung failure to perform an act required by law when prevented by some lawful act. So, usually, ito yung mga magkaiba-ibang law kasi minsan yan nakakainis sila, no? Exempted daw yon. Okay? So, next is mitigating. So, pag sinabing mitigating, ito yung may physical defective and dumb. Tapos, over 70-year-old or under 18. Tandaan na, 70-year-old, over, tapos under 18. Mitigating siya. No intention to commit so grave or so wrong. Parang accident lang din, diba? Okay, sufficient provocation, threat preceding the act, then immediate vindication, ito nag-surrender. Okay, next, surrender voluntarily. Parehas lang yun, vindication of consequence, then suffer from such illness that diminishes willpower. Willpower. So, parang ano siya, on and off siguro yung pagka-insane niya ito, no? Yung, okay, so mitigating natin is ponsis. Next, aggravating. Trickery, taking advantage of superior or, ito, parang politician ka or doctor ka, mga ganun, no? Okay, tapos, evident premeditation, pinagplanuhan nga, sabi nila. Next is calamities. So, may calamities na nga, nagnanakaw ka pa. Craft, fraud, or disguise employed. Ito yung mga nagnanakaw ng mga bata, di ba? Sabi, midwife sila, pero nagnanakaw ng bata doon. Okay, hindi pala sila midwife. Cruelty, ito, pamumutol ng ulo, mga ganon. Use of fire, limbawa, nagsunog pa. Poison, explosion. Price or reward or promises. Yan, aggravating mga yan. Ang lumalabas dyan is yung yung example nun is yung mga doctors, tapos may inutusan or yung politician din, pinapatay ng ganun. Ayan, aggravating mga yan. Okay, next alternative is may decrease criminal liability depending on the nature of effects of the crime. Sa relationship daw, sa limbawa, mother, father, mga ganun, tapos brother. Okay, next, sa intoxication. Pero sa intoxication, pag paulit-ulit, nagiging aggravating na yan. Okay? So, yung intoxication is yung, so, matasabi mong alternative kung, nung una, yun. Tapos, pero, pag paulit-ulit naman na halimbawa, manginom, nagiging aggravating na yan. So, degree of instruction or education. Sa halimbawa, hindi siya nakapag-aral, yung isa educated, so makikita mo kung ano yun, aggravating or alternative. Okay, so example tayo, drills. Number 1, under compulsion of uncontrollable force. So sagot yan is exempting. Next, number 2, there is sufficient provocation, mitigating yan. Next, act is committed with abuse of confidence. Abuse of confidence, aggravating. Next, number 4, fulfillment of duty. Okay, sabi natin kanina, number 4 is justifying. Next, mitigating. Offender is over 70 years old. Number 5, mitigating. Next, number 6, voluntary surrender. Mitigating. Okay, disguise be employed. Number 7 is aggravating. Next, number 8, defense of a stranger. Okay, number 8 is justifying. 9, acts under the impulse of an uncontrollable fear. 9 is exempting. And number 10 is offender is insane. Okay, exempting din yan. Okay, premeditating to commit a crime is considered as premeditating daw. Okay, sagot dyan is aggravating, pinagplanuhan. Okay, next. When the defendant kills someone accidentally, the answer is kills accidentally, justifying. Okay, justifying yan. Okay, so criminal concerning the midwife. Okay, sa parricide tayo, the victim is or offender is the father, mother, ascendants, descendants, and spouse, and not the brother. Okay, homicide daw pag brother eh. Okay. Okay, so topic natin ngayon is classification of persons criminally liable. So ito yung number 1, principal. So meron tayong 3 classification ng principal. Ito yung by direct participation. Pag sinabing by direct participation, ito yung doer of the act. Okay, siya yung gumawa. Okay? Next, by inducement. Pag sinabing by inducement naman is directly force or induce others. So, ito yung inutusan ka. Okay? Patayin mo siya. Sabihin ka na. No. Okay? Next is by cooperation. Okay? Pag sinabing by cooperation is indispensable. Ito. Okay? So, halimbawa, kasama mo, patayan sila. So, nandun ka, di ba? By cooperation. Next. Okay. So, ito, meron tayong pangalawa, accomplice. Pag sinabing accomplice, ito yung accessory before the fact. Okay, tandaan, before, yung accomplice is before the fact. A person who cooperate accessory before the fact or absent at the time of crime is committed. Ito yung accomplice. Tandaan, accomplice, laging lumalabas, accessory before the fact. Next is accessory. Pag sinabi naman accessory is accessory after the fact. Pagkatapos ng situation. So, ito yung elements niya. May profits, conceals, destroy evidence. O, tanda na, destroy evidence and assist the escape of the principal. Okay, tandaan. Okay, assist in the escape of the principal. Ito yung accessory. Pag sinabi accessory is accessory after the fact. Okay, next. So, situation tayo is, okay, situation, makinig. Si Danaya is 2 months old pregnant. And then, her parents do not know this. Danaya informed her friend, Alina, about the problem. Okay, si Danaya, sinabi niya kay Alina. So, Alina referred Danaya to Pirena. Okay, sino si Pirena? An abortionist. Okay, so Danaya had an abortion. Okay, so question number 1. If those involved will be charged legally, who is considered as the principal? Okay, tandaan, sino ang principal? Principal is sino yung abortion is Pirena. Okay, Pirena. Next, number 2 question, who is considered as an accomplice? Okay, accomplice, sino sa accomplice? Sino yung accomplice? Sino tumulong kay Danaya? Okay, si Alina. Okay, si Alina dyan ang sagot. Next, so next question is, if during the investigation, the pieces of evidence were not found, hindi daw nakita because Gorna, yung maid daw ni Pirena, burned it. Sinunog lahat. Tapos, Gorna is considered as. Okay, so si Gorna is ngayon, ano siya ngayon? After the fact, sabi natin, after the fact is accessory. So, the answer is accessory. Letter B, accessory. Okay. So, next. A midwife is liable as an accomplice in an abortion if she before the fact. So, if she before the fact is letter B, refers the pregnant mother to the abortionist. Okay? So, that's it. So, ulitin natin. Ulit. So, pag sinabing classification of criminal liability is number 1, principal. So, si principal, meron siyang tatlong classification by direct participation. Next, number 2 is by inducement and by cooperation. Next, number 2 is si accomplice. Ito yung accessory before the fact. And then, yung si accessory is accessory after the fact. Okay, yun yung tatlong yan. Okay, tandaan, tatlo para. Apat sinasabi. Okay, gets. Thank you. Please subscribe na lang for another video and okay, paki-click na lang yung bell. Okay? That's it. Okay, good day. So, topic natin ngayon is about test-taking strategies. So, next slides. Okay? So, each test questions consists of 3 parts. Okay? So, yung question daw, may tatlong parts. Okay? So, number 1 is introductory statement. 2, STEM. Number 3, the 4 options. Okay. So, sa introductory, ito yung mga concept or subject na pinag-usapan doon sa question. So, ito yung number 2 naman, yung STEM niya, which ask na ito yung ito yung mga questions. So, how, what, which, when, or yun naman yun. Okay, so yung 4 options naman, ito yung A, B, C, yun. From which you must select the answer. Okay? So, meron tayong option A, option B, option C, and option D. Okay? So, next slide. Example. Ito yun. Ito yung introductory niya. The mother asks you the possible contraindication of immunization. So, yung STEM naman, which of the following situation wherein immunization is being contraindicated? Okay? So, yung option A, malnutrition, option B, diarrhea, then option C, mild respiratory infection, and D, age. Okay? So, doon tayo sa keyword. So, ang keyword niya is contraindications of immunization. So, alam natin, contraindication ng immunization is yung fever. Diba? May fever yun above 38.7 or something like that. 38.5. And then, yung mga immunocompromised patient. So, tingnan mo dyan sa option kung sino ang pinaka-the best answer dyan. Okay? So, ang sagot natin dyan is age. Siya yung pinaka-may immunocompromised. Next. So, skip, return, and check. Okay? Kung mahirap yung question, skip mo muna. And then, babalikan mo na lang. Tama? Okay? Next, rule number 2. Read the questions carefully before looking at the options. Identify keywords in the STEM. Okay? So, keyword, sabi natin kanina na dun sa una, yung contraindication. Tama pa? So, ito yung technique natin. Read the question carefully. So, habang binabasa mo yung question niya, yung introductory saka yung STEM, iniisip mo na yung sagot. So, parang nagpo-process ka na ng mga sagot mo doon. So, pag tingin mo lang sa option, kung nandun na yung naisip mo, ayun na yun. Tama ba? Okay. So, next, watch out for these words. Okay? So, yung first, primary, initial, early, best, most, least, most important, priority, ito yung except, inappropriate, appropriate, yung mga ganun. Okay? So, paki-encircle lang. O kaya, kung may time, sulat nyo para mas maganda. Ako daw, nung nag-exam, sinusulat ko siya para malaman kung ano doon, talagang nandun yun. Okay? Except, sinusulat ko din, except, ganun. Okay? So, example, an early signs of respiratory distress you might observe is, okay, so yung keyword natin dyan is early. Early, tama ba? Early. So sabi natin sa early RDS, ang pinaka-compensatory mechanism sa RDS is magkakaroon ka muna ng increased pulse rate. Okay? So yung late po dyan is yung late, yung cyanosis. So ang sagot natin dyan is letter A. Next, rule number 4. Answer difficult questions by eliminating the obviously incorrect response first. Then, select the best of the remaining questions. Quickly reduce your options to only 2. Okay, kung mahirap daw talaga yung questions, difficulty questions po tayo, eliminate nyo po yung dalawa. Okay. So, tingnan nyo muna kung ano yung pinaka-unrelated doon or basta yung hindi siya nagsasuggest doon sa mga option, tanggalin mo na lang. So, para maging 50-50. Tama. Okay? Next. Example. When teaching the client about orthostatic hypotension, you should explain that it can be modified by. Okay? So, keyword natin, concept natin is orthostatic hypotension.